Medicare just released the home health rates for 2026, and if you don't understand how these changes affect your specific patient mix, you could be leaving thousands of dollars on the table every month. In the next 5 minutes, I'm going to break down exactly how these new rates work and what you need to do to maximize your reimbursement under the updated structure. Here's what most home health agencies don't realize about the 2026 rate changes. These aren't just minor adjustments to existing numbers. These represent meaningful shifts in how Medicare calculates your reimbursement that require you to completely reassess your revenue strategy. The home health Medicare rates for 2026 continue operating under the Patient-Driven Groupings Model, but with significant adjustments that affect how every single episode gets valued. And here's the critical part. Agencies that don't adapt their billing strategies to these new rates are seeing their accounts receivable stretch beyond 60 days, creating serious cash flow constraints that threaten their operational stability. Now let me walk you through the three major components of these rate changes that directly impact your practice's financial performance. First, we have base episode payments. These have been adjusted based on CMS's annual market basket updates and productivity adjustments. This foundation determines your starting point for every 30-day episode, which makes accuracy in your initial billing absolutely critical for maintaining healthy cash flow. But here's where it gets interesting. The second component is comorbidity adjustments. This complexity scoring can increase your episode payments by 20% or more, but it requires precise documentation and coding. Agencies that lack deep knowledge of how these adjustments work are missing significant revenue opportunities, particularly with patients who have multiple qualifying conditions. The third component is wage index applications. Geographic payment variations mean the exact same episode type can generate substantially different revenue depending on your location and how wage index factors are applied to your claims. Now here's what's really concerning about these 2026 rate changes. They're creating real cash flow implications that go far beyond just understanding the numbers on a spreadsheet. With these rate adjustments comes increased scrutiny from Medicare contractors, which often translates to longer processing times for claims that don't perfectly align with the new requirements. Agencies are seeing their clean claim rates drop as payers implement stricter edits related to the updated rate structure. When billing companies don't have comprehensive knowledge of these rate changes, they submit claims that trigger automatic denials or requests for additional documentation. This means your money sits in accounts receivable for 90 days or more while issues get resolved, if they're resolved at all. But here's the part that really impacts your bottom line. The 2026 rate structure places even greater emphasis on the connection between documentation quality and payment amounts. Agencies with weak documentation processes find themselves receiving base payments instead of the higher rates their patients actually qualify for, resulting in thousands of dollars in lost revenue per episode. So how do you maximize your revenue under these new home health Medicare rates? The key lies in ensuring every episode is grouped correctly from the very start. This isn't just about accurate coding, it's about understanding how patient characteristics, timing, and clinical factors interact to determine your payment group under the new rate structure. Agencies that lack this strategic knowledge often see their episodes grouped into lower-paying categories, even when patients qualify for higher reimbursement. The difference can be hundreds of dollars per episode, which adds up to significant revenue impact across your entire patient census. We're talking about potentially costing agencies tens of thousands in lost revenue annually. Here's something crucial about the 2026 rates. They include specific timing requirements that affect payment amounts. You need billing expertise that understands not just what services to bill, but when to bill them for optimal reimbursement under the new rate structure. This includes understanding how episode splits, therapy thresholds, and visit patterns interact with the rate methodology. Without this knowledge, agencies often inadvertently trigger LUPA payments or miss opportunities for higher episode groupings that could increase their revenue by 15% or more per qualifying episode. Now, let me tell you about the technology piece that most agencies are missing. Successfully navigating these 2026 rates requires sophisticated data analysis capabilities that go beyond basic billing software. The most successful agencies use data to predict how rate changes will affect their specific patient mix and revenue projections. This isn't just about historical reporting. It's about using current patient data to forecast cash flow under the new rate structure and identify potential revenue gaps before they impact operations. Agencies without this analytical capability often discover rate impacts only after claims are processed, when it's too late to optimize their approach. This reactive stance leads to revenue shortfalls that could have been prevented with better forecasting and strategic billing adjustments. But here's what I see happening with many agencies right now. Even those that understand the basic concepts of these new Medicare rates are struggling with implementation challenges that impact their revenue performance. Many agencies underestimate the training required to properly implement new rate requirements. This leads to billing errors that result in underpayments or denials, directly impacting cash flow and requiring costly rework that consumes significant administrative resources. The solution isn't just training existing staff. It's ensuring your billing approach incorporates deep knowledge of how rate changes affect every aspect of your revenue cycle. This requires expertise that many agencies don't have internally, particularly as Medicare's documentation requirements continue to evolve. Here's the bottom line. Success with home health Medicare rates in 2026 requires a comprehensive approach that combines deep knowledge of rate mechanics with strategic implementation across your entire revenue cycle. This isn't just about billing correctly. It's about billing strategically to capture every dollar your agency has earned. The agencies that thrive under new rate structures are those that view billing not as a compliance exercise, but as a strategic revenue optimization function. Your agency's financial success in 2026 depends on having billing processes that are both compliant and optimized for revenue generation. Ready to see exactly how the 2026 rate changes will impact your agency's specific revenue stream? We'll analyze your current patient mix and billing patterns to identify the optimization opportunities that could increase your reimbursement under the new rate structure. Contact us today for a free consultation and let us help you streamline your home health billing. If this helped you understand how to maximize your revenue under the new Medicare rates, make sure to subscribe for more home health billing insights. Drop a comment below about which part of the 2026 rate changes concerns you most, and don't forget to share this with other home health administrators who need to know about these critical updates.